In the fall of 2011, the need for Belmont University counseling services skyrocketed. The fall 2011 semester broke all previous records, including for mental health crises on campus. Director of Counseling Services Peg Leonard-Martin notes the increase for mental health counseling on campus forced the department to implement its first waiting list.
A waiting list makes the person feel very stuck and very neglected and not responded to, but even worse, if you can measure it this way, their problems get worse and worse.
Those problems, Belmont junior Emma Reeves thinks, could turn into a worst-case scenario for some Belmont students.
And so then if you're forced to wait 2 months, 3 months, eventually you may talk yourself out of it, or you might kind of resolve the problem yourself so you don't feel like you really need to go anymore, or worst case scenario, things get worse and something extremely detrimental to the student happens.
To Leonard-Martin, the waiting list was a, quote, serious problem and, quote, intolerable. That's why Counseling Services has worked to stop using the waiting list.
Last spring, a full-time position was added, and she quickly filled her caseload and has remained this way.
In addition to adding another staff member, Leonard-Martin confirmed space for Belmont students on waiting lists at Vanderbilt Psychiatric Hospital and nearby TriStar Psychiatric Facility. To prevent such increases in the future, Reeves thinks we should look to each other for help.
In a way, we all have to be responsible for each other, and I firmly believe that the only way to do that is through education.
From Belmont, I'm Dustin Stout, Vision News.